Here are my disclosures. So, the organization of stroke care is fundamental to implement acute treatments. The stroke unit is the most powerful intervention to safely and effectively implement reperfusion therapy. More than technology, the stroke unit has a multidisciplinary team with a systematic approach and a well-established pathway for stroke patients. Can be used for all stroke patients. It's level 1A of evidence decreasing mortality and disability for stroke. In 2014, the World Stroke Organization launched the Roadmap for Quality Stroke Services together with an action plan. The roadmap is an implementation tool that provides the framework for the implementation, monitoring, and evaluation of stroke services globally. It provides standardization and consistency for the selection of evidence-based recommendations and approach to implementations in clinical practice. The roadmap classifies the services in 3 levels: 2 stroke centers, essential and advanced, and 1 minimal healthcare service for area with low access to doctors and resources for stroke care. It suggests resources and protocols to be implemented in each level. The goal is to achieve as many check marks as possible in the roadmap checklist to provide the highest possible level of stroke services. This year, we launched an online tool, the Roadmap Online, to help the services to evaluate their structure and to improve in the same category and to know what they need to upgrade to another category. So you can see here classifying minimal, essential, and advanced stroke centers. And here the centers can see what they need to improve in each category. And also we can identify hospitals that are minimum but have the structure to be an essential stroke center. Together with the World Stroke Organization, World Health Organization, we perform a survey to evaluate the situation of stroke services across the globe. In 84 countries, 318 hospitals, and we saw that the stroke units were presenting 91% of high-income countries' services, in contrast to 18% of services in low-income countries. Acute treatments were offered in 60% of high-income countries' hospitals, compared to 26% of low-income countries. And in general, only 50% of countries reported at least 50% of all recommended elements for acute care, with most in high-income countries and upper-middle-income countries. In this study, we classified the hospitals through the roadmap of World Stroke Organization. So you can see here, essential stroke services, acute inpatient medical services to provide stroke care, CT scan, IV thrombolysis, and physicians trained to assist acute stroke in local or through telemedicine. Advanced, in addition to items listed in essential, physician, specialist in stroke, inpatient rehabilitation, and endovascular treatment, and minimal all other hospitals. And we saw that 18% were advanced, 17% essential with thrombolysis, and the others were minimal. So only 35% of hospitals had minimum required structure of a stroke center, minimum. The others are classified as minimal stroke service. So this paper showed the situation of organization of stroke care across the globe. Huge efforts have been done in recent years to improve stroke care in Latin America, with an increase in the number of stroke centers. The World Stroke Organization Ibero-American Stroke Society certification of stroke centers was created to ensure that the hospitals implement and monitor all priority evidence-based strategies in stroke care. It's a great opportunity for continuous improvement of services and qualification of comprehensive care in the region, with the commitment of stroke centers as organizers and trainers of the entire local network. This certification is based on the World Stroke Organization roadmap. It suggests resources and protocols to be implemented in each level. For this certification, the centers will be classified as essential or advanced, and the executive committee of the program defined the mandatory criteria to certify each level of stroke center. Here are the chairs, Werner Hake and Carlos Cantu. Here, Patty Lindsay, that created the roadmap, Vitor Urrutia from Johns Hopkins, that is the chair of board review, and several important international experts giving support and helping the organization and implementation of this certification program. We have 11 countries participating, educational committee, and this amazing working group. The steps for certification. First, to fill the self-assessment tool to evaluate the status of the hospital. If the hospital meets the criteria, to fill the online application for certification form. If approved and needs 100% of mandatory elements and 75% of recommended in each level, the hospital is pre-certified and should submit the supporting documents. After the submission of supporting documents, is scheduled an on-site visit. And after the on-site visit, an international board review gives the final approval. The board suggests actions to improve the services, and the certification will be reviewed in 2 years. Here you can see the criteria for certification. We have the criteria mandatory and recommended for essential and advanced. They are rigorous criteria to certify the hospitals, since access to hyperacute stroke care, access to basic diagnosis services, advanced diagnosis services, access to emergency medical services, pre-hospital and training, access to nurse and nurse assessment with stroke training, physician with stroke expertise in acute care, that can be neurologist or stroke physician, program to develop and maintain competencies in stroke care, both are mandatory, access to stroke unit, access to acute intravenous thrombolysis, both are mandatory, members to interdisciplinary stroke team, that are mandatory, neurologist or doctor with expertise in stroke, stroke nurse, nursing assistant, physiotherapist, and speech therapist, and the other members of stroke teams are recommended. Access to stroke unit protocols that are mandatory for both the basic approach to stroke units, access to advanced interventions, someone mandatory for advanced centers as endovascular thrombectomy and neurosurgery, access to stroke rehabilitation services, organization of stroke care, and coordination of stroke care in the region, and research that is recommended for advanced. Here is the platform. You can see here the organization and the partners, MT 2020 SVIN. Here our sponsor. So at the end, you will see for advanced, met 100% and need 100%. And here you need 75% of recommended. For the second certification, need to improve to 85% of recommended elements. So here the center is able to be submitted for certification as advanced stroke center. So this is the self-assessment tool. You see if you have the criteria, and after you apply in this similar formulary, but officially apply to certify your center. You see here is ready. You will need to include the documents. What the documents is the most important: training to the whole group, service protocols, record of performance measures, a quality indicators registry, a strategic plan to improve the quality of stroke care in the service. So we have in the program several educational tools from Angels Initiative, Medtronic, Rapid AA, Global Stroke Alliance, and also the World Stroke Academy. We create an educational teaching course for nurses. We have 12,000 nurses participating in 11 meetings, 17 hours. The program was structured in 5 months since October 2020 and was launched in March 2021, working with societies and Ministry of Health in the countries, with 5 to 10 delegates each country. Here is the results of self-assessment tools, 178 hospitals tested, and 66 are ready for certification, 44% are public, 28 pre-certified hospitals, 11 essential, 17 advanced, 5 already visited, and 4 already certified. You can see the countries that already apply for certification. The on-site visit, we compare the medical records with the quality indicators registry to prove the veracity of the data. We evaluate the pathway of the patient inside the hospital, and we evaluate the quality indicators metrics. Here, the first hospitals visited, one private and one public in Brazil, other private and other public. The first board review was on September. I'd like to thanks to our partners and sponsors, because we have a fundamental characteristic of this program that is no cost to the hospitals. It's free, allowing all hospitals participate, public or private, because we believe that all qualified hospitals should be certified regardless of the payment. In conclusion, in a short time, it was possible to create and to implement a certification program for stroke centers with the opportunity for continuous improvement of services. The hospitals are improving to be certified, and the program can be a model for certification in other regions. Here is the website. And thank you.